Notwithstanding the fact that there are sessions at conference that are specifically aimed at patients and public, I think it's important that the patients see the spectrum of the cancer research world, but also that the clinicians and the scientists and the researchers get a chance to meet patients and carers. It's certainly unique in my experience, after 6 years of experience of the cancer research world, that there are far more patients and carers in this conference than you will find anywhere else.
Having patients here and consumers here is just a reminder that we have to focus on what's going to give the best value to consumers in terms of improvements in treatment and improvements in outcomes, and that's what the consumers are here for, I think.
The researchers, scientists, medical professionals, they're the experts at the creating of the drugs and administering the drugs and doing the diagnosis. But when it comes to actually having the illness, living with it, knowing what it's like to have to take the drugs and go through the treatments, then we then become the experts. And if we don't contribute, then I don't think the medical professionals nor the researchers would get the full story of what the other end of the table is like.
I'm constantly surprised by the sheer passion and energy that researchers, clinicians and everybody associated with the conference actually put into. The energy is boundless and amazing, and I'm constantly reassured by that of the work that's going on towards cancer research in general. And I think the more patients and carers that we get involved with all of the different streams of work that the NCRI do, the better.
I was invited to become a consumer member of the NCRI's Lung Cancer Clinical Studies Group, and I accepted, and through that I became a member of the Consumer Liaison Group, and I'm also now a member of the Consumer Involvement Steering Group. I mean, I think I've now, in the past couple of days, I think I've got myself involved in about another 3 or 4 committees or groups, you know. So these things happen. It's great, it's terrific, you know. And I also think, I might be totally wrong, but it seems to me that this year there seems to be more involvement in the programme of members of the Consumer Liaison Group, which has got to be a good thing.
I was joint chairing a session with the chair of the NCRI Informatics Board, Sir Alex Markham, and there was a series of presentations which were focused on how much more data is becoming available for research. So we looked at some examples of how other countries are getting data from clinical settings and making it available for research. There was an example from this country about GP data that's being made available for research. And then there were a couple of really interesting presentations about specific pieces of research into disease that have come about actually almost as a surprise by people looking at this great kind of wealth of data that's now available and spotting things that have led them to then undertake some research. So my role in the sessions was just to make sure that people remembered why we're doing it, and that as well as being excited about all of the new research we can do, we also bear in mind the implications of that research for the individuals that it's going to be affecting and the individuals' data that's being used.